Good day to our respected lecturer. I am Nur Akila Arifah, and today I am honoured to lead our group presentation for our Anatomy and Physiology course. Our discussion today centers on the skeletal system, but we will be focusing specifically on a very common yet impactful degenerative condition known as osteoarthritis. This presentation is designed to bridge the gap between normal joint and the change that occur during disease progression. I am presenting this topic alongside my partner Muhammad Harid Irfan. I will cover the foundational anatomy and the introduction to the disease, while the Harid will take over later to discuss the clinical pathophysiology and management strategies. To guide you through our section, I will begin with the skeletal system basic, including definition, function, and joint types. Then, we will transition into osteoarthritis by exploring its causes, risk factor, and symptoms before Harid concludes with diagnostic and treatment. The skeletal system is the main framework of the human body that supports our structure and protects our vital organs while allowing for movement through the condition of joint and muscle. Because our mobility and quality of life depend on this system, condition like osteoarthritis can be very debilitating. Formally, the skeletal system is defined as the framework that supports the body and enables movement. It has several vital functions, which include supporting our posture, protecting organs like the brain, heart, and lungs, acting as levers for our muscle, producing blood cells in the bone marrow, and serving as a storage site for essential minerals like calcium and phosphorus. This system is made of bones, joints, cartilage, and ligaments. We classify joints into three types based on mobility, which are synovial joints that are freely movable, like the knees, cartilaginous joints that are partially movable, and fibrous joints which are immovable, like the sutures in the skull. Osteoarthritis is a degenerative joint disease that occurs when the protective cartilage that cushions the end of your bones wear down over time. This leads to pain and stiffness, most commonly in the hand, knees, hip, and spine. To help visualize this wear and tear process, let's watch this video which demonstrates how the joint's environment changes as the cartilage disappears.
What is osteoarthritis? Osteoarthritis is the most common type of arthritis. It affects around 9 million people in the UK and is more common among women. In most cases, people are over 45 when they get it. It can cause pain and stiffness in joints. The most common joints to be affected are the knees, hips, back, feet, and hands. To understand what happens in osteoarthritis, let's first look at how a healthy joint works. A joint is where two or more bones meet. They allow bones to move freely without letting them move too far. A joint is held together by a capsule and ligaments. There is a soft inner lining to the joint called the synovium. A thick fluid is made by the synovium which protects the joint and helps bones move freely. Thin layers of tough, slippery tissue called cartilage act as a protective cushion to stop bones rubbing against each other. Muscles are attached to tendons, and tendons are attached to bones. Our muscles pull our tendons, which in turn pull our bones. Osteoarthritis starts when cartilage starts to thin or roughen. This can happen naturally during the aging process. There are also things that can make this more likely to happen, for example, being overweight or an injury. Once the cartilage has started to thin or roughen, the body puts in place a repair process to try to make up for the loss of cartilage. The repair process may work well, but can sometimes cause further problems. New bits of bone may grow within the joint. Extra fluid can also build up inside the joint. The extra fluid and the new bits of bone can cause swelling and may force the joint capsule out of shape. If you have osteoarthritis, try to maintain a healthy weight and keep moving as much as possible. Exercises to strengthen the muscles around the joint can improve symptoms of pain and stiffness. Taking painkillers can help you stay active and exercise. It can be tough having osteoarthritis. However, remaining physically active and continuing with your hobbies, normal routine and social life can help you manage your condition.
To be more specific, osteoarthritis is a chronic condition characterized by the breakdown of joint cartilage and the underlying bone. It is often described as a wear and tear disease where the protective tissue at the ends of the bones gradually disappear. The primary factors that cause this breakdown including aging where cartilage loses its repair ability and past joint injuries from sport or accident. It is also caused by repetitive stress for constant pressure on a joint during work or hobbies, as well as obesity which adds significant mechanical stress to weight-bearing joints. Please look at this slide where we compare a normal knee joint to one affected by osteoarthritis. On the left, the healthy joint shows smooth cartilage and a clear medial meniscus that act as a shock absorber. However, on the right, you can clearly see the formation of bone spurs and degenerated cartilage where the joint space has narrowed. Looking at the risk factors, being female and older age are high-risk categories, while obesity and previous joint injuries significantly increase your chance. Furthermore, genetic and bone deformities also play a major in the development of this condition. I will now hand it over to Harid to discuss the advanced science, pathophysiology, diagnostics, treatment, and prevention. Thank you.
Okay, so thank you for the explanation, Akila. Okay, so now we on a common system of osteoarthritis. Okay, so now we got 6 symptoms on here, and also the explanations. Okay, so the first thing is joint pain. Okay, pain that get worse with movement or after being active for a long time, but gets better with rest. Okay, and then morning stiffness. Stiffness that lasts than 30 minutes, especially after waking up or being inactive. And then we got swelling. Soft swelling around the joint happens because of irritation and the breakdown of cartilage. Okay, next we got loss of flexibility. Difficulty in bending, straightening or rotating the affected joint. And then we got tenderness. Okay, so the explanation is joint feels sensitive or painful when you apply pressure. Okay, and then the last one is reduced range of motions. So the movement becomes limited as cartilage wears down. So now we add a sign and advanced system here. They have 6 sign. Okay, so the first one is joint deformity. Okay, so joint may look larger, bent or oddly shaped because of bone spur formation. And then the second one is crepitus. So a cracking or grinding feelings occurs when moving the joint because of rough bone surface. And then joint instability. So the joint may feel loose or unstable since the supporting structures are weakening. Okay. And then next one is muscle weakness. Muscle around the joint weaken because of less use and ongoing pain. And then difficulty performing daily activities. Okay, so trouble walking, climbing stairs, squatting or gripping objects due to hands osteoarthritis. And then the last one is severe loss of mobility. So in the later stage, movement becomes very restricted and painful. Okay, so the next part is pathophysiology. So what happened inside the joint? Okay, so for cartilage degeneration, the smooth cartilage on the ends of bone gets thinner, lose flexibility, and begins to break down. So this reduces its ability to absorb shock. Okay, the next one is joint space narrowing. As cartilage wears away, the space between bones gets smaller. This causes the bones to move closer together. Next is bone-on-bone contact. With less cartilage, bones begin to rub against each other. This contact pain, stiffness, and limits movement. Next is formation of osteophytes. So the body creates extra bone at the edge of joints to stabilize them. This bone spurs lead to pain and limit movement. And then we got synovial inflammations. The synovial membranes become slightly inflamed. It produces enzymes that cause more damage to the cartilage. And then loss of synovial fluid quality. Joint lubrication decrease, and then this leads to more friction and faster wear of cartilage. And then subchondral bone sclerosis. The bone under the cartilage becomes harder and denser because of increased pressure and stress. And then the last one is joint instability and muscle weakness. As joint structure weaken, the muscle surrounding the joint also lose strength. This because instability and leads to more joint damage. First is inspection. So the doctor check for visible signs, swelling, joint deformity or bony enlargement. This change happen because the joint structure is wearing down. Okay, next, palpation. When touching the joint is pressed gently to identify tendons, warm or thickening, and then pain on touch indicates inflammation or cartilage damage. And then we got a range of motion assessment. The doctor move the joint to see how far it can bend or straighten. In osteoarthritis, movement becomes limited due to stiffness, pain, and narrowing of the joint space. Okay, and then crepitus detection. Crepitus is a grating or cracking sound felt or heard when the joint move. Okay, it occurs because the smooth cartilage is damaged, causing bones surface to rub. Okay, and then we have a checking for joint stability. The doctor evaluates whether the joint feels loose or unstable. Weak ligaments and muscle imbalance around the affected joint can cause instability. And then the last one is muscle strength assessment. Muscle around the joint are tested for strength. People with OA often have a weak surrounding muscles because chronic pains reduce movement and exercise. Okay, so this is the example. We got the X-ray here, MRI, ultrasound, and for other tests is we do the blood test. Okay, so the next part is treatment. So we got the lifestyle change, medication, injection, and physical therapy. So for the lifestyle change, rest the effect muscle, gentle stretching, stay hydrated, and eat healthy, maintain good posture. Okay, so for medication, we got the pain relievers, muscle relaxant, and topical pain creams. And then for injection, steroid injection for severe inflammation. And then trigger point injection for the muscle nodes. And then the last one is we got a physical therapy. Okay, so stretching and strengthening exercise, heat or cold therapy, massage and manual therapy. Okay, so the last part is surgical intervention. So we got the 4 here. The first one is muscle repair surgery. So they use when a muscle is completely torn and cannot heal on its own. Okay, so the next one is tendon repair or reattachment. Okay, so performance if the tendon pulls away from the bone, it's in major injuries. Okay. It also removal of damaged muscle tissue to allow proper healing. And then the last one is fasciotomy, a produce to relieve pressure in the muscle. It's used in serve compartment syndrome. Okay, so now we add the prevention and completion. Okay, so skeletal muscles problems can be reduced through a simple habit such as warming up, stretching, using proper exercise technique, staying hydrated, that's more important, and eating a balanced diet, also avoiding overuse, maintaining good posture, and strengthening supporting muscle also help prevent injuries. So overall, skeletal muscles are vital for movement and daily activities, and most issues can be managed with lifestyle change, medication, physical therapy, or surgery when needed. Taking early action and practicing healthy routines keep muscles strong and support long-term mobility and overall health. Okay, so that's all from us for this topic. Okay, thank you.